Have you ever had two different clients who had the same MRI, but one had pain, the other one didn't have pain? Why is that? Maybe you've worked on the same upper trap, or you've worked on the same lower back QL muscle that you've constantly worked on with someone, and the pain just always comes right back. This is why massage therapists need to understand spine mechanics. Now, we don't diagnose spinal conditions, but we do need to understand how the spine affects the muscles, the joints, the body. How does it affect movement, pain, compensation, all that? That way, if your client says, hey, my neck hurts, or hey, my back hurts, painful spot might not be where you're actually going to start working on, or it may not be the cause of what's happening. Remember, pain is an alarm, it's not the root cause. Instead of asking, where does it hurt, you need to ask, where is it coming from? What is the true starting point? Why is this area overloaded in the first place? And is there another area that's being restricted? And is the nervous system protecting something? Is the muscle tight because it's the problem, or is it the compensation? Here is a common example. A client comes in with neck pain, their upper traps and their levator scapula are tight. They're also getting headaches. Now you work the upper traps, you work the levator scapula, and you work the suboccipitals. Feel better temporarily, but there's more to it. We worked all here, but their thoracic spine is stiff and their rib cage is restricted. And their head is sitting forward. Well, his can't move, but his head is sitting forward like this. Those same neck muscles are going to be getting overloaded. Now, the neck pain is real, of course, but it's not the only thing driving the problem in the first place. Another example, lower back pain. A client can have very tight lumbar muscles, an elevated hip, or limited hip mobility, and poor thoracic rotation. Lower back might be working overtime because the hips and mid-back are not moving well. So here, not moving well, this is working overtime. Compensation creates overload, and overload creates symptoms. Now, let's go over the 5 sections of the spine. We got the cervical spine up here. The 7 vertebrae are C1 through C7, and they're highly mobile. They allow flexion and extension, rotation, and side bending. So that's a lot of stuff they do. Because they have so much movement, that also can create a lot of stress on it. It is vulnerable to stress from posture, screen time, all that. Thoracic spine is the mid-back, and it has 12 vertebrae, connects it with the rib cage. The ribs support the organs and help breathing pattern and contribute heavily to trunk rotation. So when the thoracic spine gets stiff, guess what? The neck, low back, they compensate. The lumbar spine is the low back, and it has 5 vertebrae, and it's built for weight-bearing shock absorption, allowing force transfer, and it does flexion and extension and side bending. Now, it does not rotate nearly as much as the thoracic spine. Then we got the sacrum, connecting the spine to the hips, helps transfer the force between the trunk and the legs. Coccyx, the tailbone is small, but it's an attachment for muscles and ligaments, and it can affect pelvic floor function and sitting. Between each vertebrae, you got the disc. The disc absorbs shock, absorbs compression, and assists with movement, maintaining the space between the vertebrae. The disc and the facet joints work together. The disc handled the pressure, the facet joints handle the movement. Facet joints are the small joints on the back of the vertebrae, kind of in between right here, connecting the vertebrae from the one above and below it. Their job is to guide motion, provide stability, and limit excessive movement, and help distribute the stress. Now, one interesting note is that you got your cervical, thoracic, lumbar, all the facet joints going down, each section are different. They're shaped different. Cervical facet joints allow a lot of movement. Thoracic facet joints favor the trunk rotation, but the rib cage limits how much movement is available. The rib cage connects into there. The lumbar facet joints allow less rotation, but they allow extension and flexion more. That's also why the lower back doesn't tolerate repeated excessive twisting, as well as the mid back does. Key thing, when one area loses the mobility, another region has to pick up the slack. This is very important for massage therapists because it helps explain the symptoms. So the symptom can be affected by something way far away from it. Now let's talk briefly about chiropractic adjustment. Many clients who see massage therapists will also see chiropractors. Obviously, spinal adjustments are outside of the scope for massage therapists. Understanding what's happening does help us communicate with the client. Now think of the facet joints we mentioned of. The chiropractic adjustment is meant to free up restricted facet joint areas, or restricted joints, and improve the movement. The pop sound is not your bones breaking or your bones going back into place. It happens when pressure changes inside the joint and gas bubbles from within the joint fluid. Some adjustments will pop and some don't. The sound itself is not the treatment. Improvements after an adjustment may come from changes in the joint motion, nervous system input, muscle tone, pain perception, and movement confidence. But if the underlying cause remains, poor movement habits, weakness, postural stress, repetitive loading, or compensation, restriction or the pain may return. That is why long-term progress is usually affected as well by soft tissue work, muscle activation exercises, along with the adjustment. Clinical mistakes is assuming that a tight muscle equals the problem muscle, meaning if this is tight, this may not be the problem. A muscle could actually be tight because it's protecting an injury. It can also be compensating for weakness. It may be responding to restricted joint movement, or it could be reacting to nervous system sensitivity. So instead of asking, how do I loosen this muscle? You may ask, why is this muscle tight in the first place? Because that question will change how you treat a client. For example, if someone comes in with chronic upper trap tightness, of course you're still going to work the traps. You also might need to work on the rib cage mobility, the thoracic spine, breathing pattern, shoulder blade work, shoulder blade position, forward head posture. It's a whole domino. If someone has chronic lower back tightness, you're still going to work the lumbar muscles, but you're also going to want to assess the hip mobility, glute activation, pelvic position, one higher, one lower, that kind of rotated back or forth, or even thoracic rotation. That's clinical reasoning. It's not to diagnose anybody. It's to recognize patterns and compensation, so you know which areas that you may need to work next. So again, remember, the spine is a connected system. Each region has different roles. Cervical and thoracic need excessive movement. Lumbar needs controlled mobility and stability. Sacrum is the key for force transfer. Disc absorb compression. Facet joints guide motion. Restricted movement causes compensation. Compensation can create overload. Overload can cause pain. When a massage therapist understands spinal mechanics, they stop chasing the pain and start thinking about the whole body and the pain response. It makes treatment smarter and more effective.